No Cannabis Before Opioid Use Disorder Treatment Policy Challenge by Megan Brooks. New research challenges the policy of some opioid use disorder treatment programs that require patients to abstain from cannabis before qualifying for treatment. Essentially, the rule in some clinics is that if you test positive for THC, you can't receive your methadone, buprenorphine, or naltrexone. People with opioid use disorder are tied to using these medications as treatment and to prevent withdrawal symptoms. So this study was a meta-analysis of 10 pooled studies with a total of 8,367 participants. The patients were tracked for an average of 10 months. The study concluded that cannabis use did not have a statistical association with the use of street opiates or medically prescribed opiates. This study is more proof that the gateway hypothesis is false. Cannabis use should not be a barrier to receiving life-saving medications for opiate use disorder, says lead investigator Dr. Joao de Aquino from the Department of Psychiatry at the Yale University School of Medicine. Policies that mandate the abstinence from cannabinoids should be reconsidered. The rationale for the study was that the relationship between cannabis use and the risk of relapse among people with opioid use disorder was unclear. Basically, some people wondered if the use of cannabis would drive people with opioid use disorder to relapse. Commenting on this research, Dr. Scott Hadlin, Chief of Adolescent and Young Adult Medicine at Mass General for Children, said, "Ideally, treatment should be patient-centered. When someone is receiving care for an opioid use disorder and is also using cannabis, we as clinicians should be working with the patient to determine whether they're interested in or able to cut back on their cannabis use at the same time as their opioid use disorder. In many cases, patients choose not to make changes to their cannabis use. This might be because they have physical pain and cannabis might be helping to control it. There are lots of other reasons patients might choose to continue their cannabis use. Regardless, we want to meet the patient where they are and support any positive changes they're seeking to make in their opioid use, even if they aren't able to make changes in their cannabis use." Dr. Hadlin goes on to say that the data from this study shows that cannabis use doesn't affect opioid use disorder one way or another, and I have to agree. Once someone has opioid use disorder, I have seldom seen cannabis reduce a craving or need for opioids. However, I have seen many patients use cannabis instead of opioids for pain relief. So, cannabis likely prevents opioid use disorder, but does not treat it. Overall, I have to stand on my chair and applaud for Dr. Hadlin's comment on meeting the patient where they are. Too often, doctors have the tendency to enforce medicine rather than practice medicine. If we act as guides rather than police officers, we might accept cannabis as medicine and prevent a lot of people from dying with opioid use disorder. This is Dr. Jean Talleyrand with good news from the medical front at High 9 News.
Wow, Dr. T, this is huge news. So what does this do for people that say that cannabis is part of their harm reduction in regards with opioid addiction?
Well, yeah, I mean, they say that, but I don't know. And the proof is not there yet. It's not showing that they are actually reducing opioids or increasing opioids. So maybe because they're staying the same, they're saying that's proof enough. Mm-hmm. But, science takes its course.
I think this is fascinating right here. What do you think about this, Rico? You're on mute. You're on mute, buddy.
There we go.
You
guys hear me?
Yeah. You're good.
I think this is fantastic. It's a huge movement towards this too. Do you think that they will start allowing this like en masse or anytime soon?
Well, the rule usually is if you're going into a drug treatment program, which is basically what they're talking about with opioid use disorder, If you're going into a drug treatment program, you get tested every day, and then you get handed your methadone, if you test positive for any drugs, illegal drugs, then you get kicked out of the program.
Right.
This study is saying that if you're testing positive for THC, you're not going to get kicked out of the program. You shouldn't be kicked out of the program. But that's what the science is saying. Now those who run these programs have to pay attention to the science and change their rules. So we've still got a ways to go.
Wow.
Yeah, they let you smoke cigarettes, though, right?
Mm-hmm. They let you drink coffee too. Don't forget that part.
Right. Yeah, they let you take caffeine. They let you, and they let you take nicotine. Like,
yeah,
I think they should allow you to partake in cannabis.
You have any thoughts on this, Dr. Mark?
Yeah, I mean, it would only seem that if you could even think of it just as replacement. So if they're not using an opioid, but they're using cannabis, chances are they're going to be alive tomorrow, right? So harm reduction, right, Dr. T? Isn't that what the Hippocratic Oath is prescribing? Which is, what can we do to reduce harms? People who have chronic pain and chronic pain issues, cannabis is a safer alternative and opioids. We know this. There's fact. We don't need to do any more research on that. I guess what we really need to do research on is that, like when opiates are prescribed, are they the front end medication? Like a lot of times you'll just, like if you get like a tooth extracted or something like that, it'll give you Novocaine at the office, but typically it's just extra strength Tylenol or a few ibuprofen. Right, Dr. T? I mean, they try not to, maybe in 10 or 15 years ago where an opiate would be prescribed, now one actually would not. I mean, is there a change in opiate prescriptions at the doctor level, Dr. T, do you think? Just because of the awareness of opiate use disorder?
Absolutely. Well, just because the DEA has been tracking prescriptions more, the doctors are writing opiates much less. And so it's actually turning people toward cannabis because cannabis is more accessible now than opiates.
So you would think somebody with opiate use disorder, it would actually almost be a beneficial thing if they found THC on them. It's kind of like, I don't know, is it called replacement therapy? So if they're using cannabis in replacement of an opiate, what is wrong with it? Isn't that harm reduction by definition?
Yeah, it is, but harm reduction isn't a popular practice, and you have to understand that doctors are decades behind in terms of it. But this is sort of a sign that hey, we're starting to say, oh, maybe cannabis is okay. So to me, that's good news. I know for us in the industry, this is old news. It's decades old news. But finally, we're making some movement in the medical field, just inching movement slowly. But that's the way it is with docs.
Yeah, you would think just the awareness about opiate use disorder that today a physician is going to think twice before prescribing an opiate and maybe try to figure out whether or not this patient could succumb to opiate use disorder before getting him hooked to begin with.
But the real thing is they're already hooked. So there's prevention where they're not hooked yet. And that's really where you want to steer them toward medical cannabis. And then there's people who are already hooked. And this is what this study was on. Those who are already hooked, who are already using the methadone, is it okay for them to use cannabis? And this study is saying yes.
Interesting. Any thoughts
on this one, Elise?
Yeah, I do. I'm happy to see the study and the article published, but agree with Dr. T. I mean, this is stuff that we know that cannabis is, it can be an exit rather than a gateway drug, an exit drug or harm reduction. But unfortunately, the policies are actually really far behind. I mean, in any treatment center, in order to get treatment for any addiction, you have to be clean of all substances. So even if you use cannabis as a medicine and you want to get treatment for something else, you have to abstain from your medicine, which actually deters a lot of people from getting the help they need. And that's why there's actually some new treatment centers here in California that have started to specifically to help people with addiction and allow them to use cannabis while they're in treatment. And then, I mean, even with the Cali Sober movement, a lot of that started was because people wanted to be sober but still use cannabis, and they felt somewhat, again, alienated from the other recovery scenes. But also, it's policies so far behind in the sense where if you have Medi-Cal, so state-sponsored insurance, thus you're getting your health care from the state in a way, and then you want certain prescriptions, they actually can, or I've been told this by my doctor when I've been honest about my cannabis use and how it helps me, they say, well, if you want to be prescribed a controlled substance, you actually can't be taking cannabis because you have Medi-Cal. And so another barrier to entry for people who are low income or perhaps have, again, state-sponsored insurance, technically, legally shouldn't be consuming this federally illegal substance, even though it's been medically accepted here since 1996. So again, a barrier for people who want health care and, help for other things that, cannabis is not an issue for. A lot of these programs still see it as this drug when actually it can be very helpful. So I'm happy to see this published. But yeah, we actually have a lot of work to do because we do need to get it accepted so that people can still use it, in my opinion, while they're healing from their other addictions.